Let's get to our first guest. During the whole pandemic, the aforementioned press has worked to stifle scientific debate and facts. And that means we in the conservative movement have sought diversity of thought to get well-rounded perspectives out there. Let's welcome in immunologist for global health and immigration medicine, Dr. Alex Diaz, along with Chief Medical Advisor for the Truth of Health Foundation, Dr. Peter McCullough. Gentlemen, welcome. Dr. Diaz, we'll start with you. As millions of Americans out there, they're being forced to take the China virus vaccine. Team Biden says they're no longer mandating illegal aliens to take the vaccine at the border. Tell me what the science is. Where are the Democrats following the science here?
Hi, Chris. Thank you so much for having me on the show. And thank you. And it's an honor to be with Dr. Peter McCullough. Well, about the vaccine and immigration, I really think that it's something that we have to bring together. And if we remember, this was part of Title 42. And Title 42 was a Public Health Service Act that it started in 1944. So this is an old regulation. And basically, it's aimed to prevent the spread of communicable diseases. And that's why in March 20 of 2020, during the Trump administration, the Department of Health and Human Services with the CDC suggest President Trump that they would like to start implementing Title 42 to prevent COVID-19 to spread into the United States with illegal immigrants. So I really think that that is the basis of what's going on right now. And the CDC later...
Well, Dr. Diaz, just forgive me, sir. I just want to boil down here. Do you see the science in saying that illegal aliens don't have to get the China virus vaccine, but American citizens do? Is there any science behind that decision?
Oh, no, definitely not. No, definitely not. Okay. There's no science behind that, definitely.
Okay. Very good. Dr. McCullough, we'll go to you. New York City is seeing a rise in China virus cases, bringing back the possibility of imposing restrictions, which, of course, is baffling to people who've been paying attention, because after 2 years and multiple studies, we know that lockdowns and restrictions had no statistical impact on the spread or the death rate of the China virus. So for folks who claim that they're following the science, they don't seem to be acquainted with the science, do they?
No, they should be just adopting practical rules like sick people being excused from work, students be able to go home. Only the sick people need to quarantine during the early treatment program. They should have a fully developed early treatment approach now for high-risk patients to go through a sequence of drugs, starting actually with the nasal virucidal washes with povidone iodine or hydrogen peroxide. Very high-risk older individuals can receive the monoclonal antibodies. We have the Lilly torcept. And then we go through the sequence of oral drugs. You know, Pfizer has a Paxlovid drug, but we have older drugs we can rely on as well, ivermectin, hydroxychloroquine, and then go through prednisone. I've seen patients today in the hospital who've recently been treated for COVID. We're down to nearly 0 hospitalizations and death now, Chris, with early treatment.
Yeah, and none of these lockdowns seem to be at all, well, the science doesn't back that up. Dr. Diaz, Dr. Fauci, in the meantime, His Eminence, Dr. Fauci, skipped out on the White House Correspondents' Dinner because he says the pandemic isn't over. But earlier in the day, he attended this garden brunch. He had no mask on, close proximity with other left-wing elitists. With all of his disinformation and his mixed messages throughout the pandemic, do you think it's time, Dr. Diaz, that Dr. Fauci resigned from his high-paying job?
Chris, before we get into that, what I can tell you is that, Dr. Fauci, he has been talking about this narrative for a little bit over 27 months now. And it's very difficult. I don't see Dr. Fauci saying something different. So to be honest, what I really think, and a lot of my colleagues worldwide think, is that we think that the pandemic is over. The real pandemic is over. This is time to act not on fear, but faith and knowledge. This is the time to bring everybody together and have the specific knowledge and the courage to, just forget about the pandemic and move forward to something more positive and valuable.
Well, Dr. Fauci just enjoys all of the power he's been given. Dr. McCullough, at least 10 states are reporting an alarming increase in cases of severe hepatitis or inflammation of the liver in previously healthy children ages 1 month to 16 years. What do we know?
Chris, I've been following this story, and there was a breaking paper by Marsh and colleagues from Scotland in Eurosurveillance, 13 children, similar cases. And the common feature was probably a background of having recent COVID-19, whether it was clinically recognized or not, the respiratory illness, not the vaccine, but the respiratory illness, and then a superimposed virus, adenovirus, enterovirus, rotavirus of some sort. So it's almost a double hit on the liver. We really need our CDC to investigate this. They need careful serologies, both for COVID-19 and then the offending agent. You know, in the Eurosurveillance report, 1 child needed a liver transplant. These are serious cases. The parents should be aware of signs and symptoms of hepatitis, abdominal pain, fever, lethargy, jaundice, and seek prompt evaluation.
Mr. Diaz, you are a pediatrician. I wanted you to weigh in on this as well. Have you seen anything like this in your practice so far?
Never before. We are very worried. I've been talking to a lot of ministers of health of different countries like Singapore, Japan, and other countries, including people in public health in Canada. And, you know, there are over a little bit 200 cases of hepatitis, acute hepatitis of unknown origin. And no, in the United States, it started in Alabama in October, and then North Carolina and Illinois. Now we have information that there are at least two cases in Minnesota and 4 cases in the state of Wisconsin. So this is alarming. We have places like United Kingdom, Israel, Romania, Japan, Singapore with new cases. And I think this is, we have to create a task force with specialists, pediatricians, immunologists, public health specialists, and global health specialists to try to understand exactly what is the common cause of this and try to make the correct diagnosis and the proper treatment.
Yeah, something has to happen. If we could just get all the politics, left-wing politics out of the CDC, that would be great. Last thing, Dr. McCullough, I want you to weigh in on this. First grade teacher telling students that doctors don't always get gender correct. Watch.
When babies are born, the doctor looks at them and they make a guess about whether the baby is a boy or a girl based on what they look like. And most of the time that guess is 100% correct. There are no issues whatsoever. But sometimes the doctor is wrong. The doctor makes an incorrect guess. When the doctor makes a correct guess, that's when a person is called cisgender. When a doctor's guess is wrong, that's when they are transgender.
Okay. Dr. McCullough, genetics are quite clear on what makes a male and a female in the human species. Should gov ed teachers be allowed to teach counter to science, Dr. McCullough?
No, they shouldn't. They're injecting intentional confusion and what's called gender ambiguity into our classrooms, and it's completely inappropriate. The doctors, of course, make a clear determination of gender at the time of birth. In fact, it's known by ultrasound in most cases many months before that time. This type of activity should stop. I think it's going to lead to great confusion and ultimately harm our children in their understanding of their own development over the course of their lives.
Yes, psychological harm in particular. Thank you both. Doctors Alejandro Diaz and Peter McCullough, we appreciate your time tonight.